Welcome to Erpho's training videos, supporting people to use population health data and analysis. In this video, we're going to look at a commonly used tool across many Erpho products, spine charts. We call them spine charts because information is arranged around a central line, which usually refers to a regional or national average, with information about the various indicators stretching horizontally across it, like ribs around a backbone. In this chart, we can see that the central line is red, and shows us the average values for the whole of the East of England. You might not have seen this type of chart before, but once you understand how the information is presented, you'll see how they're a really useful way of getting a clear overview of an area and how it compares to other places. Looking at this chart, which comes from the fingertips tool on the Erpho website, we can see a number of indicators, or things that we can measure, down the left-hand side. The indicators here are being used to measure health and well-being, and in this example, we're looking at the health of people in Cambridgeshire. Next to each indicator are various numbers, which set out the local values, so here we're looking at people in Cambridgeshire, the England average, and the regional, in this case the East of England average. We need to be careful about how we interpret these numbers, as a higher value in some cases is a good thing, for example the percentage of new mothers that initiate breastfeeding, and in other cases a higher value is a bad thing, like when we're looking at the number of deaths or accidents. Each indicator has a count and a value. So here, the 1478 refers to the number of mothers with a known breastfeeding status who initiated breastfeeding, and the area value, 82%, tells us that this 1478 represents 82% of all new mothers with a known breastfeeding status who initiated feeding in Cambridgeshire. Looking across the chart to the right, we can see that the proportion of mothers who initiate breastfeeding in Cambridgeshire is higher than both the East of England and the England average. The same information is set out visually in the spine chart, which also tells us a lot more, namely what the range of values within the region is and whether the difference that we see in the numerical values presented on the left is significant. The light grey bars show the spread of values within the region, between the worst and the best figures. The dark grey bars, which sit within them, show the middle 50% of values. You may have heard this referred to as the interquartile range. The central average, the red line, will often fall within the interquartile range, but it doesn't always, as we can see here when looking at the percentage of maternities with known smoking status. The circles show us how the place that we're interested in this case Cambridgeshire, fits within this range of values. The colour of the circles shows whether the value for the area is significantly different from the comparator area or benchmark. Red circles are significantly worse than the benchmark. Amber circles are similar to the benchmark, and green circles are significantly better than the benchmark. So in this example, we can see that when compared to the regional average, the percentage of women aged 53 to 70 who are screened for breast cancer in the last 3 years is significantly better than the regional average. The percentage of women smoking at delivery is similar to the East of England average. And the rate of hospital stays for alcohol-related harm is significantly worse than the regional average. It's a lot quicker and easier to use the coloured circle to spot indicators that are different from the benchmark than having to look through all the numbers on the left. Sometimes you'll see light or dark blue circles being used instead of red and green. We used blue circles when looking at indicators for which high or low values cannot be interpreted as being good or bad. For example, if we look at this information on age, we can see that the proportion of people in Cambridgeshire in all 3 age categories, which include those aged 65 and older, are significantly lower than the regional average. Knowing this is helpful, as it helps us to target our services appropriately, but doesn't include a value judgment about whether an older or younger age distribution is a good thing. If you see white boxes or blank areas in the spine diagram, this doesn't mean the tool is broken, but just that the information isn't available at this point in time. As you can see, spine charts are a really valuable tool for communicating a vast amount of information in a single display. Once you're familiar with how to interpret them, they'll help you to quickly identify areas of excellence, those which may need some improvement, and to help compare the performance of local areas. Remember, indicators only indicate. They require you to investigate further to see why there might be an issue. We hope you found this video useful. Please let us know whether it met your needs by sending us feedback. Take a look at our other videos or visit our website for other resources.